anyone who has taken one of these, sleep aids and medications. New startling data shows 1 out of 3 of you tell us you're taking sleep aids to fall asleep, whether it's over-the-counter or even allergy meds. And for the first time ever, I'm revealing the results of a 4 million night sleep investigation to find out just what these sleeping pills are doing to your sleep and to your brain. Are these pills hooking you up, taking good care of you, or are they keeping you in a vicious cycle of poor sleep?
It's a health alert that can't be ignored. Doctors around the country are sounding the alarm about patients over-relying on sleeping pills.
Sleep loss and sleep-wake problems are considered a national epidemic.
Self-medication with over-the-counter sleep aids is okay in some circumstances, it's not okay in others. It's not a good idea to rely on those for long-term help.
You can also have difficulty with dizziness and confusion and falling over, and long-term, it can cause problems with severe difficulty with memory.
For the nearly 70 million Americans struggling with sleep disorders, a pill may seem like an easy answer.
For the past 3 years, I haven't been able to fall asleep organically. So I've had to rely on this over-the-counter sleep aid to help me fall asleep.
I cannot fall asleep unless I take a sleeping substance.
That's why I launched my sleep investigation, using sleep score data from 4 million nights of sleep across the country. Using Sleep Score, we were able to track not only the hours of sleep, but also the quality of sleep by collecting information on light sleep, deep sleep, and REM sleep. What we uncovered might make you rethink taking that nightly sleeping pill.
Our sleep team is here today. Sleep expert Dr. Thanuja Hamilton and Dr. Jennifer Caudle, along with the Sleep Challenge group of viewers who say they all have taken sleeping pills within the past month, and they have volunteered their sleep info for our 4 million night sleep investigations. A lot of people. So we're going to dive right into what we have uncovered. 4 out of 10 women in our study tell us that they are using sleeping pills. 4 out of 10, which means it's even a bigger problem in women than in men. So Dr. Caudle, why? Why are they relying so much on sleeping pills?
Well, you have a really good point about women using sleeping pills. We know that the majority of people who use sleeping pills are women. Could be a number of things, whether it's like the pressures of life or stress or maybe even hormonal. As a family doctor, I have a number of postmenopausal patients who complain that their sleep has been disturbed since going into menopause. But the thing about it is the sleep pill medication industry is a $41 billion industry.
Oh my goodness.
We're spending over $41 billion a year on sleep medications. And now with over-the-counter medications, they're more and more readily available.
Dr. Hamilton, why are people making mistakes? And what are the typical ones they're making with these pills?
Well, people need to realize that over-the-counter sleep aids are not intended for nightly usage. In fact, people are taking them more and more, and if you take them nightly, you're going to need them nightly. There are warning labels out there that say you shouldn't take them more than 2 weeks at a time, and people are mixing them with medications, anti-anxiety medications. This can increase confusion, sedation, disorientation, and even worse, cause a drop in your blood pressure.
I'm going to emphasize something. The label actually says, don't take it for more than 2 weeks. Am I right?
That's right.
Right, so even if we just read the instructions, we see it right there, we ought to be smart about this. So let me bring in some of these women who say they are using sleep meds. If you don't mind, should we show of hands? And thank you for volunteering to be honest and a part of this. How many of you take a sleep aid once a week? Hands up. We're pretty much almost everybody. All right, 3 times a week. Who's using them 3 times a week? Who's using them 5 times a week? My goodness, it's a lot of you. Are you surprised? According to our 4 million night investigation, most women who take a sleep aid, they use one of these over-the-counter sleep pills. So it's not a doctor prescribing it to you. Julie, I noticed that you put your hand up when the 5 times a week issue came up, which implies that you're taking probably more than you want to.
Yes, correct.
So what do you think about this? You're not alone, by the way.
No.
So when did you start taking them?
I would say I travel a lot. So I'd say for the past 15 years.
15 years?
Yeah. Yeah, on and off for 15 years.
What kind of worries do you have about that?
I would like to find something more holistic to, help me sleep instead of taking a pill to help me sleep 5 to 7 nights a week.
Right. Are you all desirous of getting off sleeping pills?
Yes.
Okay. So you're on something you don't want to be on, and we got to find some answers for you. So Dr. Hamilton, what exactly are people taking to fall asleep?
Well, diphenhydramine is in many over-the-counter sleep aids, and that's an antihistamine. Now, it can help you sleep when it crosses the blood-brain barrier, but in the body, it can also help with allergies. Now, people might take allergy medications to help them sleep. They might have other ingredients. You may not know the correct dose, and that can become a problem. In fact, if you mix it with other medications, alcohol, there are dangerous results that could happen from that.
I mean, if you're taking a pill for allergies and you're trying to sleep with it, that's not the primary reason folks came up with the solution. All right, now you say there's some side effects that we can run into. These are sleeping pill hangover side effects, something that I hadn't thought of much.
Yeah.
So please walk us through them, because I bet a lot of you, especially if you're taking a lot of these pills, might be running into these.
Yeah, well, patients will take sleeping pills and say, why aren't I feeling refreshed? Why aren't I feeling great? I'm still tired the next day. Well, in fact, the effects of the medication can linger into the next day, and that can cause you to be overtired, it can give you blurry vision, and it can affect your mental alertness. And that can be a problem with work performance, and even worse, motor vehicle accidents.
Right. It can be very severe.
And it seems so safe. You're taking an over-the-counter product, right?
And that's the problem.
Who would think? So in fact, here's a sleep confession Julie made after taking an OTC sleep med the night before.
I take the over-the-counter sleeping pills because I have a hard time staying asleep. I can fall asleep, I just don't stay asleep. So I've tried everything over the counter. And every morning I wake up and I feel groggy and cloudy and I can't shake it off.
Julie, you don't look very happy there. So what is it like when you can't get a good night's sleep?
I can't function at work. I'm cranky. I'm angry. I'm on edge. I just feel like I need to go back home and go to sleep.
Yeah, which is how a lot of American females are feeling now. That's called, how does a sleep pill hangover work?
Well, and this is a real thing, let me tell you. So you might have problems sleeping, okay? And you take a sleep pill, okay? That's fine, but the problem is the next morning you might feel almost hungover. That's what a lot of my patients call it. You might feel groggy, you might be forgetful, but you're at work, so you gotta function, and what do you do?
One of these pills is gone.
One of these pills, you've taken a pill. Thank you, Dr. Oz. So we're gonna reach for the coffee, because we gotta stay awake.
You like coffee?
Yes, I like coffee. So
I suspected you might from that video.
we're gonna do a cup of coffee because it's got caffeine, it might help us stay alert, but the problem is that may not cut it, so we're gonna do another one. And I don't know how many people drink more than 2 cups of coffee a day. There are a lot of people. You might even need that 3rd cup of caffeine to help you stay awake. The problem with that, though, is that by the end of the day, you then might have problems going to sleep and may need another sleep pill. What this does is it creates a vicious cycle, and it really doesn't deal with the underlying issue. It can actually be very problematic.
And this is the cycle that we fall into. It's actually more like a whirlpool, getting sucked down the drain. Another problem, of course, Dr. Hamilton, is one that you talk frequently about, which is not just a quantity of sleep.
Oh, yeah. According to research, although these sleeping pills might help you sleep longer, are you really sleeping better? Not really. In fact, it can affect the amount of REM sleep that you get, and that's your restorative stage of sleep, and that affects your daily functioning.
So moms are right, I guess, right? Quality over quantity.
Absolutely.
Which most of us aren't even aware of, but ends up being really important when you're trying to live your life the right way. So up next, the biggest question that we get asked: can you become addicted to sleeping pills? Find out what you need to know. All right, time for the #1 question I get asked about sleeping pills. Are you ready for it? Can you get addicted? It's a wise question to ask. So we've talked about the cycle of sleeping pill abuse. But we get the hangovers. But then there's also another problem. It's probably even a bigger one: tolerance.
Right.
So if you're out there, counting sheep, right? Let's make you a sheep. You take your one pill, then you take another pill, very slowly, very daintily, walking your way through this, and then hopefully, right, you've gotten where you need to be. That's not what happens. Your body knows you're taking all these pills, right? So what does it do? It races through the rest of these pills, and soon the same pills that used to help you over here don't help you anymore over here. That's the biggest fear that we have. And that's why I think, although we talk about addiction with opiates, this is a different kind of addiction. This is being addicted in a way where the pill no longer works for you. So let's go on over here. I got a little quiz. All of our Sleep Challenge women are here, and I know you've all got questions. But before you ask us, I got one question for you. You've witnessed us talk about some of the concerns we have about taking sleeping pills chronically, even violating what the box warns you about. Concerns about that? Worries? What kind of insights? Sorry?
What's it going to do to your liver eventually?
What might damage other organs that you have? Other concerns?
Dementia.
Dementia.
Definitely. Yeah. From personal experience and knowing of older individuals that did that and demented.
Yeah. Yes, ma'am.
How is it going to affect our mental state, our brain?
Yeah. Even before dementia. So I would hope that in general you're not so happy about what you heard. Right? It's not the cure-all that you're hoping it was. Is that a fair reflection?
So I wanted to know, like, is there an actual safe way to use the pills, and like when can you use them?
All right. So let's wrap all these up into one if you can, and specifically address the issue of how long you can take them and how many you can take.
Yes. Really, sleeping pills are intended for 2 weeks at a time when you're going through a difficult period or transition. So limited to 2 weeks. You also want to avoid taking sleeping pills more than 3 times a week. And listen to your body. If you're having side effects, it might mean that that's not right for you. You might need to talk to a doctor to switch to something else. And also, allot at least 8 hours when you're taking a sleeping pill, because you don't know how you're going to react the next day, and we don't want you to have that morning hangover, which can increase risk.
When you say 3 times a week, what's the benefit of not taking it every day in a week?
By avoiding taking it every day, you're decreasing that risk of dependence, where you need it every night, and tolerance, where you start needing higher doses.
Thank you very much. Appreciate it very much. I want to thank all you women for being honest and thoughtful about these issues. I know they're affecting a lot of us.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.